patients who are undergoing treatment for colon cancer are, neglect or become scared about the treatment because of the fear of a ostomy. Ostomy is basically when an intestine is put on your abdominal wall, and the motion, the feces does not come out of your anus, but actually it comes out of the abdominal wall into a bag. So a lot of people fear that if you have colon cancer, the surgeon will put you on a bag, and because of that they delay treatment or defer treatment, and then finally end up with very advanced stage disease. So an ostomy in a colon cancer is done in very few selective situations. So most of the time in a temporary ostomy means we bring the intestine out temporarily for a couple of 4 to 6 weeks, and then it's closed and your stool passes through the normal route once again. So we do a temporary ileostomy or a temporary colostomy, sometimes for rectal cancer or sometimes for left-sided cancer, in which the patient has come with an emergency situation or like an obstruction in which the colon is hugely swollen up and it's not very healthy to take the stitches. In those kind of patients, we actually do a temporary stoma, and after 4 to 6 weeks the patient gets his normal intestinal route. Well, in some cases, in rectal cancer, in the lowermost part of the rectum, when the rectum joins your anal opening, at that point, if the cancer goes till there, you can have the muscles which control the evacuation of stools, the defecation. We call them the sphincter muscles. You have the external sphincter and the internal sphincter. These muscles can actually get involved by the tumor, and in those kind of cases, we can need something called a permanent colostomy. That means the anal opening and the sphincter complex is completely removed to clear the tumor, and then you have a permanent bag. So this is a very small group of patients of the lowermost rectal cancer, that is the carcinoma of the large intestine, which is involving the rectum, which is the area above the anus, and in that the lowermost part. Even that area now, with advanced technologies, we have transanal microsurgery, and a lot of sphincter saving surgeries are being done, for which even patients with the cancer which is coming very close to the anus, we are able to preserve the sphincter. But of course, there are a certain group of patients in whom we have to actually sacrifice the sphincter and go for a permanent colostomy. It is only in these patients that you need a permanent colostomy, but rest of the other groups of patients, like other regular rectal cancer, left-sided cancer and right-sided cancer, most of the time you don't need a colostomy to treat a large intestine cancer.